My plastic surgeon was a male, and his first words, and I don't necessarily think that they meant to be malicious, but he said, "Do you ever want to have children?" Because the thing with breast reduction surgery is if you have it done before childbearing, you have a 50% less chance of being able to breastfeed. Now, for some women, that is very important. And so medically, that provider brought it up because if I was someone that really did care about that, and I did not have the ability to breastfeed after surgery, that could be something that was very, very detrimental to me. But at the same time, the way he did bring it up was just very, he did not approach it well. And that is something that I think physicians, male physicians especially, do not know how to approach with women. You don't just ask someone, "Oh, do you know if you want to have kids later?" He didn't really explain to me why he was asking the question in the first place, which would have been obviously a much better approach. If you're not getting the care that you feel like you need, or you don't feel like your doctor is listening to you, I would fire that doctor. I would find someone new. I would find a second opinion. Unfortunately, there are a lot of cases of physicians not listening to women. There are cases where a lot of physicians just say, "Oh, it could be related to that time of the month. Oh, it's not that big of a deal." They just brush it off. If that happens, find someone new. I fired my neurologist at 15 years old, and my mom was not happy with me. 2 months later, we figured out what was actually wrong with me because I got a different neurologist and figured out what was going on very quickly in about 2 visits with her. You do have to advocate for yourself. It doesn't matter who the physician is. I have a habit of screening my doctor as they screen me. I ask them certain questions about their medical practice, about how they treat certain things, because if I find out a physician is anti abortion or anti reproductive care for some reason, I'm going to fire that physician and find someone else that's going to be able to support me. I, as a disabled person, can't have a physician that believes that their view is more important than my reproductive health. I think the important thing that people do need to know is that your one doctor is not the only doctor with that knowledge. You may like your doctor, but it still may pay to get that second opinion. Every doctor has different schooling, every doctor has a different, way of viewing patients and viewing medicine. I've seen two doctors in the same field write drastically different notes on patients. They were both correct in very different respects, and it just depended on the person. It doesn't matter who the physician is. You do have to advocate for yourself.